In this morning's Maryland Peace of Mind, the toll that the pandemic is taking on our older population, the struggles that seniors are going through. Joining us live this morning with more is Dr. So-Young Lee from the University of Maryland School of Medicine. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
So you work with older patients. What kind of issues are you seeing at your practice?
While everyone in the United States and all around the world had to suffer through this unprecedented pandemic and all aspects of our life changed dramatically, the data show that COVID-19 has had a disproportionately greater impact on older adults. That includes direct consequences of COVID-19 infection, such as more severe complications, more ICU admission, and higher death rate. So there is apparent fear and anxiety about getting sick from COVID-19 or other causes that might lead to death. Even if you didn't get sick, there's grief from loved ones and close friends, illness and death. New onset of worsening depression and anxiety because of stress from changes in their everyday life, so much uncertainty and unknown future and hopelessness because of it, and social isolation and loneliness from social distancing are the things that I've found have been problematic, and unfortunately it is still ongoing.
Well, they are still ongoing because as we find out more about the Delta variant and as breakthrough cases happen, more people are doing a little bit more isolating from their family members, and that can be, like you just said, detrimental to their mental health. So what do you suggest? How do we pull out of this as a people, but especially our older people who are so vulnerable?
First of all, like noticing there is any type of difficulty is more important than anything. So once you notice there is something doesn't seem right, it needs to be followed by getting an appropriate assessment. So depression and anxiety in late life are quite complicated because in many cases, patients have other conditions that contribute to those kind of symptoms. For instance, some degree of cognitive decline, in other words, mild or major dementia. So sometimes these symptoms are difficult to distinguish, and that is why it is essential to get a correct diagnosis to provide adequate support. The adequate support includes treatment with or without medications.
And so getting that diagnosis can be a little bit tricky because getting seen by someone can be tricky. So many therapists right now are completely overwhelmed.
Right. Absolutely. And another challenge is that these days, a lot of doctor's appointments are done through televisits.
Yep.
And a lot of other older patients doesn't know how to use it, or they don't have devices for that. So it significantly limit their access to healthcare. So it is vital for healthcare professionals and family members to recognize that barrier and to provide appropriate help.
So telehealth therapy is really interesting because it's provided such a window for patients who don't want to get out and see someone in person. So that's been very valuable. But there's another subset of patients who want to see their therapist in person. There are so many therapists who are not seeing patients yet in person. It's particularly frustrating because you can see in other aspects of life, people are doing things in person again. So at what point does the patient's need to see someone in person sort of overtake then that therapist wanting to not see people in person? Where is the line there?
In my knowledge, including our clinic, like we provide in-person care, whenever they need in-person care. So please reach out to providers who are willing to see you. And we also have home visits too. Certain therapists, like they can't provide in-person care.
Sure.
Like of course, like they are, using these measures that to prevent the COVID infection, but there are resources that are available there.
So with your providing some home visits as well, if somebody's interested in that, what should they do to find out more information?
You can ask your primary care provider to make a referral to geriatric psychiatry clinics or geriatric psychiatry home visit services. And most geriatric services are now doing in-person and home visit services.
Really great information. Thank you so much for joining us this morning. Take care.
Thank you for having me.
You are so welcome, and stay with